Okay, we're a couple of minutes in, perhaps we should get started. Very warm welcome to everyone. Welcome to Technology and Digital Support Talk with Dr. Debbie Wake. A few items of housekeeping. Please can you set your name as per the email that you've been sent. And there's a chat and there's a question and answers button. So do feel free to put any questions you have during the session on there, and we'll do our best to get to them at the end of the session. My name's Emma. I'm here because I have an 11-year-old son and who has type 1 diabetes. We've been coming every year since, and it's talks exactly like this, the reason that keeps us coming back. This is going to be a very interesting talk. Just a moment to thank our sponsors as well. So if everyone could have a little look at their, visit their virtual booths during the breakout sessions, that would be great. Okay, so moving on a little bit about Dr. Debbie Wake, who is the CEO and Chief Medical Officer of MyWay Digital Health, which is something we're going to learn a little bit more about and something that I think we're all going to become more familiar about. And so if you can please, during the talk, any questions you have, pop them in there on the button, and then we'll get to them at the end. I'd like to hand over now to Dr. Debbie Wake.
Brilliant, thanks very much, Emma. Now, I'm just going to try and share my screen. It says it's disabled screen sharing, so if somebody could allow me to share my screen, that would be fantastic. In the meantime, I'll just tell you a bit of background. So I am a consultant diabetologist working up in Edinburgh. So I do diabetes clinics, mainly at the Western General Hospital and down in Leith, mixture of people with type 1 and type 2 diabetes. So that's been my background. I'm also a clinical reader and academic with the University of Edinburgh, so I do a lot of research and teaching in relation to diabetes, and a lot of my work has been focused around technology and how we use technology, both in terms of my academic work, my clinical work. And as you heard, I'm also CEO of MyWay Digital Health, which is a company we spun out of Dundee University about 3.5 years ago. And the reason for doing that was that in Scotland, I'd been involved for the last 15 years in developing a national platform for people with diabetes called MyDiabetesMyWay. And having developed that and scaled it across Scotland, and it had been very successful, we wanted to take that learning to other places in the UK and other places around the world. So the mechanism for doing that was with the university to set up this company, essentially, which was able to start taking that technology elsewhere. And I'll tell you a little bit more about that as we go through. So that is my background. So I'm going to talk about technology and digital health. And actually, when you think about technology in relation to diabetes and type 1 diabetes, it can cover a massive range of things. So what I'm going to try and do is a bit of a whistle-stop tour through different aspects of technology and digital and how these can support diabetes. And then I'm going to focus in on a few examples in a little bit more detail of some of the work that we've been doing. And hopefully some of that will be relevant for you, and it will give you access to additional resources and information that you might not currently have access to. So this is what I'm going to go through today. I'm also going to talk a little bit about COVID, because I think because of COVID, actually digital health and technology has really started to move forward at a pace we've not seen before. So that's actually been a positive thing that's come out of COVID. As I say, I'll talk about some things that relate to that. So as mentioned, when we think about digital and technology, there's lots of things we can think about. If we even just look at apps, for example, that you can download from the App Store, there are now over 1,000 apps that are in the App Store for diabetes, which is just phenomenal. And it's a bit of a minefield as to, what's useful, what's not useful. These are the sorts of things that apps might be able to do. They might help you store blood glucose readings, log your insulin, put in your carb ratios. Some of them have activity trackers, some of them support around dietary intake logging, that sort of thing, and other physiological measurements. So a huge range of different apps out there. Also, when we think about wearables, as well as the sort of glucose and insulin wearables that we're aware of in terms of glucose monitoring kits, insulin pumps, there's also a whole load of other stuff like Bluetooth blood pressure measurements, scales, activity meters, and these sorts of things as well, which I think are important for all types of diabetes, because we know the impact of things like metabolic activity on blood sugar levels. So this is just going to expand more and more as time goes on. And I'll talk a little bit at the end about this sort of, if you like, tsunami of data that we were now faced with, both coming from the clinic and coming from patient home recorded information, and how we can perhaps better make use of that to use computer technology to really drive almost automated advice and care directly back to people with diabetes. So focusing on a few diabetes apps and tools, as I say, there are many, many out there. And some of the ones that I think we've been hearing a little bit more about recently are things like the Roche My Sugar app, and partly because it became free during lockdown. So again, that's one that I know is a lot of people use. There are new technologies coming out from companies like Quinn. This is a very, very new app, but it helps people. It gives predictions and supports people around insulin dosing. Digibeat I'll talk a little bit about later, because Digibeat has been nationally commissioned by NHS England, so it's now free for anyone living in NHS England. If you live outside that territory, again, it's a very cheap app to download, and I'll talk a little bit more about what that does. And then you've got tools like Bertie and Daphne that are more online education systems that can support structured education courses online. So these are just a few examples, but as I say, there are many, many apps and tools out there. The other thing that we're seeing in the sort of digital world is obviously social media. And I think social media is incredibly divisive. I think people either love it or hate it. Some people with diabetes, though, do find it undoubtedly very useful, and the peer support through social media can be very effective. And I'm sure some of you are very familiar with this. And I think if you are using social media, you know, certainly on Twitter, you need to get up to speed with some of the hashtags and the people that you need to be following to get the content coming through. Hashtag PWD, for example, people with diabetes is quite a good one, hashtag type 1 and so on. So I'm not going to talk in detail about that just because of time today, but we're seeing a huge amount of content, information, advice and peer support now happening through social media, and there's actually quite a lot of emerging research about this, which is really interesting in how it can indeed support people, particularly in niche areas, things like, you know, people who are, let's say you've got type 1 diabetes and you do triathlons, you might never meet a person in your clinic who does that, but actually through social media you can connect up in some of these specialised areas, just as an example. I'm going to talk a little bit about My Type 1 Diabetes, because this is a website that we've been involved with developing for NHS England. So as I mentioned, across the whole of Scotland, we have a site called MyDiabetesMyWay, and I'll come back to that in a minute if you live in Scotland. But if you live in England, My Type 1 is a website that is there and available for you. So it's free. It's been commissioned by NHS England, and it was commissioned for us to develop this at the start of the COVID epidemic, really in response to them wanting to put in place some sort of online resource education tool that would support people with type 1 diabetes, and particularly when social distancing, as it still is, where we're trying to limit the social distancing and limit the amount of clinical contact. So suddenly clinicians found they couldn't deliver the usual group face-to-face education that they wanted to. So this is there as an alternative or an adjunct to that. So just to tell you a little bit about what's in that website, the address is here. So please go to the site, please use it. It's got over 200 educational resources and structured e-learning courses. I'll show you some of those. You need to register to use the e-learning courses. The 200 resources are free, accessible to anyone from around the world. So even if you're not in the UK, go to the website and you'll be able to access an awful lot of content that's been generated by us, other healthcare professionals. It's all been clinically validated and hopefully is useful. And this is really in response to the fact that when we look at the number of people with type 1 diabetes who actually attend some sort of structured education at the time of diagnosis, and by that I mean a sort of course which would usually be delivered maybe face-to-face, either one-to-one or in a group setting. And this is something that the national guidelines tell us everyone with type 1 diabetes should be attending one of these courses, whether it's Daphne or Bertie or a local equivalent or a paediatric equivalent. Everyone should be getting a curriculum-based structured education programme at diagnosis. Actually, only about 7% of people do actually manage to attend and complete one of these courses. So it's a very, very small number. So there's a huge gap here in terms of the delivery of structured education. And often what we're finding is people are offered courses, but they, for various reasons, can't attend them. And often that's because of work commitments, because of other reasons. And these are often delivered in a very inflexible way. They're during the week, they're 9 to 5. You've got to take 5 days off work if you want to do the whole thing. And a lot of people just say, I can't do that. So the online option is there to be much more flexible, to allow people to dip in and out, complete it at their own time, and still fulfill the criteria for structured education. So this is where the government was coming from with this. So I'll just do a quick whiz through the My Type 1 site so you're aware of it and what's available. As I say, there's an open access website, loads of content, sections for healthcare professionals as well, sections specific to coronavirus. When we go into the platform, there is a no more section, which is basically broken down into different components, going through really all different aspects of type 1 diabetes, from treatment, complications, specific things around glucose monitoring. There is a kids, young adults section there as well, but they've also commissioned Digibeat as a separate app for the pediatric community, for the kids and young adults. I'll talk a little bit about that. A lot of stuff on lifestyle, a lot of stuff on patient stories, so people sharing stories. A bit on pregnancy for people who have type 1 diabetes who are pregnant. And then we've got a My Languages section as well, which has about 100 resources in other languages, non-English languages as well. So this is just an example. If we go into the complications section, then we can go through to a section on eyes. There's videos, there's narratives, and then there's a whole load of other resources that you can dip in and out of, from animations to leaflets to videos, games, and so on. This is my language sections, just to show you some of the languages that are covered there as well. This is the healthcare professional section, and again, it links through to things like national guidelines and national clinical bodies that support diabetes. And these are the e-learning courses. So this is the bit that the NHS England is particularly interested in, because they're trying to increase the number of people that have actually gone through some sort of structured education program. So we have 5 structured accredited courses available. These have been through a thing called Kismet, which is essentially a national body that accredits education, health education, and have met the kind of approval and the level that they need for that. That means they're accessible in the way that they've been written, in the way the resources have been created. They've got screen readers, you can download them. So for people with disabilities, again, they're easy to use, and we can even create a completely offline copy of the course to give to people as a handbook for people who absolutely can't access digital. So these are the 5 courses, one called Understanding Type 1. This is a great course for anyone who's just been diagnosed with type 1 diabetes. It goes through pretty much everything from the basics of what is type 1, through to things like insulin adjustment, carb counting, and complications, what to expect in your diabetes clinic. We've produced a specific course called Growing Up and Living with Type 1, which is, again, I'll show you some more information about that, but there's sections in that are particularly pertinent to young adults with type 1 diabetes. We've got 2 courses that relate to insulin pumps for people in combination with your local healthcare teams. But saying that, what this can do is hopefully mean that a lot more of it can be done remotely from home. And it means that there can potentially be a bit less clinical contact required as you start your insulin pump. And we've also just recently put into the site a completely separate course on carb counting, because the feedback we got was, although there's carb counting information in our Understanding Type 1 course, a lot of people at a later stage in their diabetes journey want to go back and refresh the carb counting stuff, or do that as a standalone course. So we've now got a standalone course for carb counting. So that's what's available. I'll just show you a few screenshots from this. So this is the Understanding Type 1 course. You can see the different aspects here. It's broken down into modules. You can do these all at once and sit for a whole day or 2 and do them, or you can dip in and out and do over a few weeks. There's quizzes at the end of each section. You can also meet and discuss with other people online. So there's discussion boards all the way through it, where people can kind of share their stories with other people online. And again, people quite feedback that they like that additional kind of peer support. But you can see here it's about what is type 1 diabetes, about understanding the treatments, how physical activity can affect it. There's a section on mental health, section on sort of alcohol and diabetes, again for older people, coping with illness. So this is all your kind of sick day rules. stuff, a bit about complications, and then looking after yourself is really about sort of attending the clinics, what targets you should be looking to achieve, and so on. And this is just an example of a breakdown of the understanding insulin section, where it takes you through, you know, types of insulins, what to take and how to inject, how to adjust insulin, and talks about carbohydrate counting and diet and so on. So that's just an example of that one course. And as I say, there are 4 different courses, and I've just shown you here a few screenshots just to let you see the sort of content that's in it. We've got sort of interactive infographics. We work with Carbs and Cal, who you may be familiar with, are a company who have an app, a book, and various other resources which help people with carb counting. We work with them, and we use a lot of their images as well, which are really helpful in terms of helping people understand how carbs and foods are broken down and have an impact on glucose levels. So a lot of that content is there. We've got loads of videos, and all our videos are a mixture of healthcare professionals and patients talking about their experience. So it's got that nice mix of people sharing their stories with sort of expert healthcare professional advice as well. So that's just kind of showing you a few screenshots of some of the infographics. We've also got these PDFs which people can download. So when you've got things like sick day guidance or information about correction doses and things, that's the sort of thing that people have said it's quite useful to have a copy of that sitting around as a flow chart, or something that you might just keep filed away for when you need it. So again, you can print off these PDFs and have them as kind of easy to hand tools if you find you need to use them. The Growing Up and Living with Type 1 course is got things covering things like travel, holidays, driving, sex, contraception, alcohol, smoking, but it's also got sections that are more pertinent for young people, like music festivals and tattoos, body piercing, leaving home, you know, these sorts of things. And we're actually just in the process of splitting this course into 2, so that we've got one bit which is more about living with type 1, which is probably relevant for everybody, and one bit that's a bit more focused on the aspects within here that are more for the sort of young adults. So that's kind of there. This is just a screenshot from that. A lot of the stuff in this is very much driven by people with diabetes and their experience and their stories. The insulin pump courses, as I say, for people thinking about starting insulin pumps or people actually starting insulin pumps. So if you're in the position of you've heard about insulin pumps, but you're not quite sure what it would involve and whether you might be eligible for one or not, this is a really good course to kind of that goes through and talks about that. And then, you know, if you've agreed with your team, you're going to actually start an insulin pump, then again, there's a separate course that takes you through what that involves. The new carb counting courses is a much more detailed course about counting carbs and insulin adjustment. So again, I won't go through this in detail, but it's a much more sort of detailed step-by-step course that takes you through worked examples where you can put in your own information, start to actually work things out. It's very interactive. I see lots of little quizzes and things to get people up to speed with carb counting. So again, I won't go through that, but it's all there, and it's all there to be accessed. So if you want to use any of these courses, if you live in England, then you just basically need to go to the My Type 1 Diabetes website, you go to the registration page, you need to put in your details, including your GP practice, and what that allows us to do is report back to the GP and NHS England, because they want to know the stats in a completely anonymous way, but want to know, you know, how many people have started the courses and finished the courses and so on. So it allows us to report back to the healthcare teams. And the feedback has been amazing. We only started this particular website in July time, but you know, the feedback, as I say, I'll let you read some of it here, but has been great. And not just people with diabetes, but I noticed that a lot of you are parents of people with diabetes, and absolutely fine for you to go on and use the resources as well. And you can see here, you know, people who've done that and said that you know, it's been really helpful for them as parents and carers as well. So that's just there for people to use. Please use it. That's the web address. Spread the word. That would be great. The other thing we're going to be doing is more online courses, what we call massive online courses. So these are MOOCs. So alongside our kind of e-learning that you can go in and do at any time, we do these what we call cohort courses, where over a 2 or 3 day period, we will say, right, we're going to run a live course using a lot of the same material that we've used in the e-learning, but it's a bit more of an event where you can come in and you can join in over 2 days. Complete the material. We also do live streaming on Facebook and Twitter, so it keeps it really interactive. We have WhatsApp groups set up, and when we've done this in the past, we did one of these at the start of lockdown for type 2 diabetes, and we got about 2,000 people all taking part in an online course at once, and there was a real kind of buzz and energy to it, and people interacting, a lot of sharing stories. It was great. We've not run one yet for type 1 diabetes, but we're planning to run one in November, at the end of November, so we're just putting the final touches to that. So again, I'll communicate that with the group when we do that, and again, if people are interested and want to join that, again, it will all be completely free, open for people to come in and join. Again, that's generally met with good feedback in the past. In addition to that, if you live in one of these areas, Lancashire, South Cumbria, Halton and Warrington, Cheshire and Merseyside, Greater Manchester, Somerset, Northwest or Northeast London, then we have a website specifically developed for your area. So these areas have commissioned us to deliver a MyDiabetesMyWay website. Now, this contains all the content I've just shown you on the My Type 1 platform, but it also has a lot of local content and local information as well. So we would suggest that if you live in one of these areas, then you use your local website rather than the National Type 1 website. And I'll show you in a minute why, because it contains a lot of extra functionality that you'll hopefully find useful. Also, if you live in Scotland, we have a national website in Scotland. It's been there for 15 years, and please use that. It has exactly the same content, but it also allows you to access your electronic health record, link up your glucose meter, and do lots of other stuff, which I'll just show you in a minute. These are the different web addresses for all these different websites. Again, we can make this available, all these links available to you. So happy for that to be circulated afterwards. If you do live in one of those regions, what you also get access to is your electronic health records. So people with diabetes in these areas can log in and they can see all the data that's been collected in the clinic, whether that's the GP or the secondary care clinic. And it's presented to people with diabetes in a very easy to understand way, color coded. Green is good, red is out of range, yellow somewhere in between. And you can use this to basically track all your diabetes parameters, including some of the things that relate more to long-term complications. So some of this is a bit more focused around the adult clinic than the pediatric clinic, but you can also see your medication appointments, and we have a functionality that allows some direct communication with the healthcare professionals through a secure messaging system if the healthcare team want to do that. In Scotland, there's also a smartphone app that accompanies that you can see here. And when you drill into some of the parameters, this is, for example, HbA1c, so you can look back, see how your HbA1c has changed over time, high, low, medium, all color coded. And the data will then drive a personalized narrative. So the message that you get here will be completely tailored to you and how your data has changed over time. It will give you hints and tips as to how you might want to improve things, and it will link you back to educational material that is relevant dependent on what your data is showing. You can set goals, you can add in new values as well yourself. So I've just shown you this for HbA1c, but basically for all the data points that we collect or that you've had measured in the lab, that will all be available and accessible. And the other sort of information is there is appointments information, letters. If your healthcare team has given consent, we will share the letters that go between the secondary care and the primary care providers for you to view. The medication data there with links through to more information about the different drugs and things as well. Yeah, explanations, as I say, for all the parameters as well, to make it really easy to understand what they mean, because not everybody at the start of their diabetes career might know what BMI is or what EGFR is or what ACR is. These are all tests that we do annually when people get into the adult clinics to check things like kidney function and so on. But you can very quickly become an expert in your diabetes care by using the system and just reading the easy to understand explanations. You can add in recordings from home. So we've got mechanisms to either manually add in things like blood sugar readings from home, or you can link those up through various systems. So we have direct links to an app called Diasend, and we're just finishing a link to a thing called Tidepool, which is a open access app, which you can download if you live in England, link your blood glucose meter data in through Tidepool, and it means it'll come into our system. And then we use that data to start to give you automated advice. So dependent on your blood sugar trends, the system will start to kind of predict things and give you tips and hints as to how to improve your diabetes care. So we're encouraging people to link their glucose data in through things like Diasend and Tidepool, and we will automatically report back on that. So in Scotland, we've got over 60,000 people using the system already in Scotland. We've got about a third of all people with type 1 diabetes already using it in Scotland. And we've shown significant improvements in outcomes for diabetes and significant cost savings to the system, because I think people are more effectively managing their diabetes, and as a result there's less complications happening, and that's a huge cost saving to the system. So that's all been really positive, and it was really on the back of having done that in Scotland through the University of Dundee and the Scottish Government that we started to roll these systems out in England, and we're now doing pilots in the Middle East, in India, and in the US as well, and we've got some conversations with the government in Malaysia. So it's a system that hopefully is going to see a lot of benefit globally, and that's what we're driving to do. I was going to just mention briefly about COVID, because it's something that unfortunately we can't, I suppose, not mention in these times. It's had a huge impact on everything that we're doing, certainly in the medical world. And I think for people living with diabetes, it can also be quite a frightening time to be living through COVID, particularly when you see statistics like this in the newspapers. 26% of all COVID deaths were in people with diabetes. This is data published from Diabetes UK. And I guess I just wanted to give some reassurance, I suppose, around some of these statistics, that I think these are massively driven by a very elderly population, mainly with type 2 diabetes, who usually have a lot of comorbidities like heart disease, lung disease, various other things. And it's not necessarily the diabetes that is driving this picture, but and so I think for people with well-controlled or younger people, and by young I mean less than age 65 with type 1 diabetes, the risk is actually only very minimally raised over the general population in terms of outcomes if you do get COVID. But I think because, it has been a very frightening time, I think, for people living with diabetes. We've had to completely transform the way we're delivering care. We stopped diabetes clinics completely when COVID started, and then we're only seeing emergency cases, and we've gradually gone back to a kind of blended model of remote clinics. So most of my clinics I'm now doing just by phoning people, and we're occasionally using video conferencing if that's needed, and we're only bringing people back to clinic when we think they're of significant risk. And that's certainly within the adult clinics. The paediatric clinics may be operating slightly differently, and of course for kids with diabetes there's less risk of COVID in the young population. Kids seem to get a very mild illness with it, which is good. And the sort of challenges I think that people are having during COVID, again, some of this may be more relevant for type 2 than type 1 diabetes, but I think, all of these things impact on blood sugar control. If you're more or less active, that will have an impact. A lot of people were reporting challenges with access to healthy foods at the start of COVID. Loss of networks, face-to-face networks that were there before. We're definitely seeing a deterioration in mental health, increase in alcohol consumption during the lockdown period. And so I think, it has been challenging, but on the plus side, actually, when we've looked at blood glucose data across our type 1 population in Lothian, we've actually seen a slight improvement in blood glucose over the COVID period. And I think that's, we do have some people who've said actually lockdown for them has meant that their lifestyle's a little bit less chaotic. They're working from home. They can actually go into a more regular pattern, daily pattern with their routines. And that's actually made it a little bit easier for blood glucose management. So I think swings and roundabouts, for some people it's been much harder. For other people, actually, it's brought a level of stability. In terms of COVID, the NHS across the UK, I'd say from a diabetes point of view, has actually been, I think, really good in terms of their response to COVID. They've been pretty cohesive around introducing strategy and policy to help with COVID. They've put in place a national diabetes helpline. So if you're not aware of this, Diabetes UK now run a national helpline that's been commissioned by NHS England for anyone with diabetes to phone up and get support. They've commissioned a number of national initiatives, including our platform, the Type 1 platform, and Digibeat, and they're starting to support a lot more in the way of home testing and home remote monitoring for diabetes. And I'll talk a little bit about some of these things in just a second. So these are some of the things that have emerged during COVID. I say the Diabetes UK helpline, the information is there, but if you go to the Diabetes UK website, again, anyone with diabetes in the country can access that. There is a different email address for Scotland as opposed to England, and a different call number, but again, it is there and it's being centrally funded. Diabetes UK have produced a lot of really good resources to support people with COVID. There's things like Diabetes 101, which is again a organisation which is publishing a lot on social media and online, both in terms of videos. They're doing sort of live chats over the internet, again, to support both healthcare professionals and people with diabetes. So loads of stuff happening, and loads of resources and support out there for people with diabetes. Digibet, I just wanted to mention, as I said, this is being commissioned alongside our platform, and this is really focusing on the paediatric community. So again, if you live in NHS England, this has been commissioned nationally. It's free for anyone with type 1 diabetes in NHS England who under the age of 18. And what you can just download the app yourself and use it, but what they encourage is for the local paediatric clinics to actually be using this in conjunction. So they will get a customized app that will be customized for their local diabetes centre. It will have the local guidelines, policies, phone numbers, that sort of thing on it, and then you will use the app as a person or a parent of somebody with diabetes to communicate with your healthcare team, and it'll have loads of information on it about how to manage diabetes, 6-day rules, information about carb counting and so on. But it's much more focused for kids. So it's a fantastic tool, fantastic app. So again, I would encourage you, if you're not already aware of this and using it, to have a look at it. I mentioned we're doing a lot more virtual consultations, which has been really interesting. And actually, despite doing most of our communication by phone or occasionally by video conference, actually feedback from people with diabetes has been really good for this. And actually people saying it's so much easier than having to be dragged up to the clinic, and I can do it in my own terms and my own time. I'm much more relaxed in my own house. So again, mixed, not everybody's saying that, but actually predominantly this is actually worked really well. And I think even post COVID, whenever that happens, we will be doing a lot more of this as the norm. Remote glucose upload, we're doing a lot more of. So I've not talked to the other big part of technology is, of course, about things like glucose meters. So Libra is now being used across the country. Everyone with type 1 diabetes who is carb counting should be able to access Libra. And if you can't, then I would be speaking to your diabetes team and speaking to some of the national team, because certainly NHS England have very strongly supported Libra being accessible to everyone with type 1 diabetes. So people who don't know what Libra is, it's a sort of sensor that you would wear on your arm, and you basically can scan with a meter. It doesn't require any finger prick testing. It will check interstitial glucose every 5 minutes. And it's just a much easier way of tracking and monitoring sugar levels, and we'll show you graphs and trends which are really helpful in terms of improving that. So in the clinic, we're using LibraView a lot. We're getting people to upload their Libra data through LibraView, and we're using that as clinicians to be able to monitor people remotely and look at the glucose trends remotely. Diasend, I mentioned, is another system, which is most secondary care clinics now have a Diasend account, and you can download a Diasend at Home app, which allows you to link in your blood glucose meter. This will link with pretty much every blood glucose meter on the market. Certainly all the finger prick blood glucose meters can link up through Diasend. Some of them link in different ways. Some of them it's Bluetooth, some of them it's a USB cable, but whatever it is, you can link it into the Diasend app, and then you can share that information with your clinic. So again, we're doing that to sort of avoid people having to come up to clinic so much. If you're using a Dexcom, there's a similar system called Clarity, and Tidepool, I mentioned, is an open source bit of kit, bit of software that came from the US, but again, it links to most blood glucose meters and means that you can share your data more easily with your healthcare team. And I think just thinking about the future, just to finish off, I guess, with diabetes, I think we think a lot about the glucose data, but actually there's a lot more to diabetes than just sugar. And I think, as healthcare professionals, we're obviously also wanting to make sure that we're screening people and keeping an eye on in trying to prevent any complications developing from diabetes. So that usually means monitoring things like blood pressure to keep the risk of any vascular heart disease problems to a minimum, screening people's eyes once a year to check on risk of eye damage, to keeping an eye on things like weight, urine testing, HbA1c and foot screening. And I've shown these pictures because at the moment we bring people up to clinic and we sit them in front of a camera and we take their blood pressure and we dipstick their urine and we send it off to the lab, and then we do the foot screening. But actually there's technology coming out now that will allow us to do almost all of these things from home. So this is a urine testing kit that can get posted out, and you just use your smartphone to take a photograph of it, and it will monitor the amount of protein in your urine. This is an HbA1c test kit that can be just posted out to people, and again they can do the testing at home. These are what we call smart insoles, which can sit in people's feet and detect pressure points. for people who are at risk of foot ulceration, for example. And most of the scales and blood pressure cuffs that you can get at home now can be Bluetooth directly, so the data can come into the electronic health record. So this is the sort of stuff I think in the future we'll be using more of, to do a lot more of that screening and monitoring at home, linking the data in remotely to systems that then can basically give automated advice. So we use a lot of computer learning algorithms, rules, and what we call machine learning, which is basically computer-based learning that takes data from multiple sources and can start to make predictions about people's health and then give them very detailed automated advice. So you could get a notification on your smartphone app telling you if your data's changed, or if you need to change treatment, or if there's something different you need to be doing in terms of managing your feet, or perhaps changing the time interval you need to attend the healthcare professionals, and so on. So this is the sort of, I think, movement, and this is a lot of the work we're doing in this area. So I will finish there. I hope that's been useful, and very happy to answer any questions.
Wow, Debbie, that was an amazing talk. I've certainly taken quite a bit from that. My son is 11, and I've recently he started secondary school, so I've done some handing over to him now, but I'm particularly interested in the My Type 1 Diabetes website, because I think that is somewhere when he doesn't want to come to mum, he can just have a look and access all of that information. So that's incredibly useful. What a great resource. We've had some questions, so if I can just pass them across to you. One person has said there's quite a lot of different systems, and I understand this. I feel the same. Obviously, I love that website that we've just spoken about. There's Digibeat. You've mentioned something called Daphne as well. Is there a single place where you can find the best for you resource?
Yeah, I mean, I think on our MyDiabetesMyWay and My Type 1 websites, we've tried to be pretty open. It's not just our stuff, but we signpost people to Digibeat, we signpost to Diabetes UK, we signpost to Daphne. So we've tried to be a bit of an aggregator of what is out there. And then we've obviously got a lot of our own content there as well. Beyond that, I think it is hard. There is an NHS app store. So if you're talking specifically about smartphone apps, there is an NHS app store. And the advantage of the NHS app store is that it's gone through levels of kind of accreditation and verification. It's actually quite hard to get in the app store. So you know that the stuff that's on there is of a very high quality and has been through accreditation. So I think that's a good place to look for smartphone apps. And then you'd be able to just hone in on the ones that are specific for type 1 diabetes. So I think that's what I would recommend. Diabetes UK as well, I think, have some forums that support patient recommendations around sort of technology and apps as well. So I would go to Diabetes UK as well and explore some of their patient forums.
Great, thank you. Certainly on the My Type 1 Diabetes, it seems to be very all-encompassing. You've got everything in there. The question is the information that we can access for our diabetic, so for example, for my son, do we have to, how is the information on there already? Is it coming from the Dexcom and the DiaSend? Do we have to, when we register, do we give that information that enables the website to access?
Yeah, good question. So when people sign up to the website, if they're in one of the areas where we're doing the data linkage, then what we do is people will consent for data movement. So the first thing you'll consent to is for us to pull your data from the clinic. So that will generally be from either your secondary care clinic or from your GP record. And that will allow us to pull information on any blood tests you've had done, any observations in the clinic, any measurements you've had done, that kind of stuff, medication record, past medical history. So that's the first consent that you would do. The second step, if you want to then link in things like your glucose meter, or we've now got links to things like Fitbit and other devices, then there's a separate page you can go to link in those additional sources of data. And again, it's with your full consent. It's entirely up to you whether you want to link those in or not, and get the benefit from that. And then again, there's an additional consent if you want to share that information with your healthcare professional. So it's all done. You're in total control really of what you want to do with your data and how you want to move it.
And you're given advice on the website based on your results?
Yep. So what we do with the data then is we give automated advice. So I didn't really have time to show that today, but for example, as the data comes through, we will alert you when it's time for certain tests to get done. We will alert you if certain tests are out of range. We will alert you if there's new educational material that's come into the site we think is relevant for you. And we'll constantly sort of link you back to information dependent on your data. So as it changes over time, if we're picking up trends and patterns, and increasingly we're using the data to predict future risks, so we can start to predict who might be at high risk of a severe hypo, who might be at risk of a ketoacidosis episode. And the idea is that we can pick these things up in advance, spot who are the people who are heading in that direction, and then start to give advice and information to try and prevent these things happening. So that's the ultimate goal, if you like.
Fantastic. That's fantastic. Had a question on the COVID stats. I know that you went over COVID. Are there any stats on T1 death?
Yes, I think yes, there are. I haven't shown this today, and if I'm honest, I couldn't tell you them off the top of my head. But it's a lot better than the general diabetes stats. So, you know, I think a lot of the stuff in the media has been predominantly swayed by older people with type 2 with a lot of comorbidities. The type 1 stats don't look nearly as scary, but what there is a clear link between the level of glucose control and outcomes from COVID. So, you know, we are encouraging people to do everything they can to keep their blood sugar control as well controlled as possible within, you know, within the normal the target ranges if possible. So that's one thing that's a clear association, but predominantly age is the biggest predictor of problems with COVID. You know, young people, again, it's unlikely that people will have a severe illness with it.
Great. Thank you. There's also definitely some interest, including from me, in the online type 1 course that you think might be going ahead in November. Is there a way that we can register our interest for that?
Yeah, what I would suggest is a couple of things. If you happen to be on Twitter or Facebook, if you wanted to follow at MyWay Digital, which is our Twitter feed, and we will be putting stuff out on that as the course becomes available. We're doing a lot of advertising on that. Similarly, we have a Facebook page, a MyWay Digital Health Facebook page. That's probably the easiest way at the moment. If people want to email me, they're very welcome to, and I will forward that on to our communications people and make sure that we let you know when it's happening. But the other thing I'll do as well is when it does become available, I'll link back into the team who organised this conference, and I'll ask if they have a way of communicating that information out to people as well.
Fantastic. Fantastic. Well, thank you ever so much, Debbie. That's been incredibly useful. I know that I certainly am going to be using that website in particular, and I've got a friend of mine, actually a babysitter who babysits or used to babysit for my son, who is type 1 diabetic, who has had pretty much very little information from her clinic. So I'll be giving this to her as well, and hopefully that will help steer her.
Yeah, no, that's great. Well, do please spread the word. And I think that's it. I mean, I think type 1 care is so variable, I think, even across the UK. And I like you, there's people out there who've had a little, you know, not as much support for their type 1 diabetes. So yeah, please spread the word. And if anybody wants to get in contact with me directly to ask any other questions or to get any more information or links to the site or promotional materials, whatever, then just let me know. Be delighted to hear from anyone.
Fantastic. Well, thank you ever so much. I'm sure that we've all found that incredibly useful. So thank you.
Okay. Thanks, Emma. Take care. Thanks, everyone. Bye now.